Sarah, would you like to go for a walk? Would you like to go outside for a walk? Why don't you just put on your coat, honey, and we'll go out in the fresh air. No, just put your hand. No, one hand at a time. Calm down, Sarah. It's all right. It's all right, honey. Just take your right hand. No. Put your... Sarah. I just don't know what to do. Every day she gets worse, and I just don't know how to handle this.
The chances of an elderly person becoming confused, forgetful, and developing severe memory problems increases with each passing year. As a greater part of the population lives beyond the age 65, the number of people with these problems will increase significantly, although older. It's estimated that 5% of the population over age 65 has a memory impairment, and 20% of people over 80 become impaired. This condition presents special concerns and problems for caregivers of these individuals, whether the person is a relative or lives in a residential facility. Through these tapes, we will discuss and demonstrate symptoms of dementia, delirium, and depression, all of which can produce memory problems and confusion in the elderly adult. We'll also look at what's known about their causes and provide information about these conditions that will help a caregiver provide the best care for the person with the disease. First, let's answer a few common questions about dementia. What is dementia? It's an impairment in brain function, resulting in impaired memory, judgment, ability to calculate, and often accompanied by confusion. What is Alzheimer's disease? Alzheimer's is the most common form of dementia. It's a brain disease caused by factors which are largely unknown and results in a slow, gradual decline of intellectual functioning, memory, and judgment. The causes of Alzheimer's disease are unknown right now, but may be related to genetics, exposure to various toxic agents, or any number of factors inside and outside of our brain. Whatever the cause, the effect is clear. Alzheimer's disease is a disease of the brain. It is not a normal part of aging. As the disease progresses, people with Alzheimer's disease eventually become very confused, incontinent, and unable to care for themselves. It is a devastating disease for everyone involved. The sometimes bizarre behavior of an Alzheimer's patient is not intentional, but it is related to the parts of the brain being damaged. It is important for caregivers to understand about the course of the disease and what is and isn't possible to change. The better you understand Alzheimer's disease, the better you will respond to the special needs of these patients. Is there a cure? Some dementias do have cures. Alzheimer's dementia does not. However, there is both medical and non-medical treatment for this condition. Medical treatment may include medications, which may help alter brain function or improve symptoms. Non-medical treatment may help the patient become more adjusted to their limitations and manage better. Both kinds of treatments have areas of success, which we'll discuss later. In all dementias, there is a loss of intellectual abilities. This means losing the ability to use information once known or learned, as well as losing basic abilities to think and to understand. In dementia, there are also memory deficits or losses, with recent memory being the first area affected.
Was really looking forward to it. You know, my wife and I were so looking forward to my retirement, but my wife died last year, and my daughter suggested I move in with her.
Mm-hmm.
And it was lonely, so I agreed to do that.
And has that worked out for you?
Yes. I enjoy I enjoy my daughter. She works, of course, so that she's not home a lot during the day. So I spend a lot of time alone during the day. See, my wife died last year, and I retired a few years ago, and
in the early stages of Alzheimer's disease, recent memory is affected. As the illness progresses, the person's judgment also becomes impaired. Memory loss affects judgment. For example, the person may no longer be aware of social niceties, such as bathing and social interactions. It causes confusion and disorientation. Later on, there may be changes in abstract thinking, such as the ability to understand humor or understand the passage of time. There may also be severe problems in what is called higher order function. This includes the ability to do calculations and language. Finally, there is often a change or exaggeration in the personality of the individual. For example, becoming more ornery or stubborn. Why should you care about the causes or the course of a person's dementia? Being knowledgeable about dementia will help you be a better caregiver. Knowing about a disease makes it more predictable in some ways. You know what to expect, or at least understand what happens better. This in turn makes your job easier and your care of the patient better. The next tape will give you the background to look at the issues, especially to decide if you need to have a further evaluation of the individual about whom you are concerned. There are other conditions in the elderly that have similar symptoms to dementia, but may be treatable. These are delirium and depression. We're going to discuss patients suffering from each of these conditions so that their differences can become more apparent. When we say that a person has Alzheimer's disease or Alzheimer's dementia, we mean that their condition cannot be cured. It is irreversible. In other words, step by step, it will gradually get worse. If a dementia is irreversible, caregiving will also become more complex and difficult over time. But some dementias, such as the brain diseases associated with disorders of metabolism, like diabetes, or dementia associated with alcohol or substance abuse, may have some aspects which can be reversed and improved. If a dementia is reversible, the level of care may decline, or at least remain stable. Let's look at the major types of dementias. There are many different disease processes that can cause dementia, but there are two types that are the most common. They are primary degenerative dementia, or Alzheimer's disease, and vascular or multi-infarct dementia. You will probably care for patients who have one or both of these dementias. In a primary degenerative dementia, or Alzheimer's disease, the memory and behavior problems follow slow, progressive, step-by-step courses in which individuals gradually become more forgetful for recent events and more neglectful of self-care. A vascular or multi-infarct dementia proceeds in a stepwise, deteriorating fashion and can happen quickly. The person may stay at the same level of memory and functioning for a considerable period of time and then show a marked change for the worse. Vascular dementias are caused by blood vessels being blocked, and to make the diagnosis, there needs to be laboratory or physical evidence of significant cerebral vascular disease and evidence from a neurological exam of persistent brain damage. Here is the spectrum of possible dementias: primary degenerative dementia and vascular or multi-infarct dementia, which we've already mentioned. There are other progressive dementias, which include Parkinson's disease, in which individuals develop severe problems of movement and balance and other problems such as dementia. Huntington's disease, a hereditary disease usually appearing when individuals approach 40 years of age and is passed on from parent to child, which involves quick, jerky movements of the face, limbs, and trunk, and eventually a dementia. Dementias associated with various physical disorders such as diabetes, thyroid disease, or brain tumors. Dementias of alcohol or substance abuse, which may be a combination of direct chemical damage to the brain combined with nutritional or vitamin deficiencies. Now, let's look at the effects of dementia, which is important information for anyone providing care for persons with dementia. People with dementia often show thinking and judgment difficulties, which make communication with them difficult. As people lose their abstract thinking abilities, they become very concrete and literal. The suggestion to jump into the car, for example, may be taken quite literally. They may take offense at teasing or joking, and even become confused by concepts such as on or under. Patients may also lose their ability to deal with ordinary problems. They may not be able to figure out how to manage their finances, pay their bills, keep themselves and their clothes clean, or do necessary household tasks like empty the garbage.
Now, we've got to get you out of those filthy things. I brought you some clean clothes from home to change into.
I don't need any other clothes. I just got these new. Go away, leave me alone, young lady.
They may also lose the ability to know what to do in an emergency.
Dad, be sure to call me if you need anything.
Sure, I'll do that.
You have my telephone number.
6033.
6033? That's not a phone number.
Isn't it? Well, it's written down somewhere.
As Alzheimer's disease progresses, it destroys the section of the brain called the cerebral cortex, which is responsible for higher nervous system functioning. This means, for example, persons lose their ability to calculate, to concentrate, and to solve problems. They may lose their ability to use words correctly, or may not understand the words that are spoken. They may forget how to use common utensils, such as knives, or keys, or forks. They may not be able to recognize or name common objects. You may hear some terms applied to these losses. Aphasia, having problems understanding words or remembering particular words. Apraxia, having difficulty with knowing how to manipulate or use common objects, such as a key. Agnosia, not being able to recognize or understand either sounds or speech, or make sense of sensory or visual input. As we mentioned before, there may be a personality change or exaggeration. The person developing Alzheimer's dementia may become more irritable, angry, suspicious, argumentative, or even hostile and combative. A calm, easygoing person may begin accusing his relatives or friends of stealing things. Sometimes a person may even develop a system of false beliefs called delusions, in which relatives or other people are conspiring against them. In more advanced dementias, there may also be sundowning syndrome, in which a person becomes much more confused, usually during the late afternoon or at night. The person may also develop false beliefs or even hallucinations, in which they hear or see things that aren't there. Often, such hallucinations are of frightening things or people. They may not recognize their relatives, or they may confuse them with another person from their past. They may become physically aggressive or abusive, and they may be verbally threatening or accuse helpers or relatives of misdeeds. Or they may become socially withdrawn from usual activities and conversation, and may then lapse into multiple physical complaints. At the same time, their impaired judgment may prevent them from accepting the social or physical help that they need.
I don't know why they come in my room at night. I know they're in the radiator. They say terrible things about me. And then they steal my money and give it to those lousy people that keep me locked up in this jail.
Sometimes, demented individuals become upset or overwhelmed by the demands or activity of social situations, especially when they are under pressure to complete a task. When this happens, they develop what is sometimes called a catastrophic reaction. A person may become openly abusive verbally or physically, or even emotionally upset. They may want very much to escape from the situation that stresses them, or the individual they believe is tormenting them.
Don't fight me.
Learning how to anticipate and prevent catastrophic reactions is an important part of management of individuals with dementia. Management problems such as these will be discussed in later tapes on behavioral management of individuals with Alzheimer's disease. The next tape will focus on conditions confused with dementia, especially delirium and depression.